As we all know, practice in the United States requires licensing by state. So we really have to be careful when we start practicing medicine in different states, as it requires a license. What's the risk? The risk is you could be accused of practicing medicine without a license, which is a criminal act. And your malpractice insurance may require you to be licensed in a state and be acceptable for practice in that state as well. So that is another risk that one needs to keep in mind. However, let's be sure that we always practice good medicine. A patient of yours that you know that happens to be away, they're on vacation, they're visiting friends or family and has a problem and calls you for advice, certainly you want to take care of that patient the best you can, but keep in mind that's really for emergency situations. And most of the time, if we're going to practice across state lines, we want to make sure we have a license to practice in that state. The best way to assure privacy when doing a telehealth visit with your patient is to be sure that both you and the patient know who's participating in the visit. You want to know who is going to be with your patient. They may or may not want family members or others present for this, and they need to know who those people are going to be. And on your side, the patient needs to know who's going to be with you. In a live visit, it's sort of obvious, but in a remote visit, the patient may not know that you have somebody else in the room with you. Finally, you want to make sure that your technology is HIPAA compliant and secure to be sure that no possible way of hacking is going to be there. And then finally, always make sure that you use good judgment on what kinds of things you're going to do via telehealth visits. Certain things are just too difficult to do and really infringe on patients' privacy. When doing telemedicine visits, misdiagnosis is a big issue. And we know from our experience at the doctor's company that we look at telehealth related claims, misdiagnosis is on the top of the list. So be careful. In the first instance, don't see patients remotely if you think there's a possibility that a misdiagnosis can occur. Remember that many visits occur with patients and you come up with things, you find things you didn't expect to find. If you think an exam is necessary, a good exam is necessary, you probably don't want to do a telemedicine visit with that patient. On the other hand, educational sessions are really great ideas to do with telemedicine, and there's less likelihood of being a problem with a misdiagnosis. Finally, be creative with examinations. Some examinations you can do with little technology that give you real insights into what's going on with your patient. And of course, there's technology available that can augment your exam and reduce the chance of having a misdiagnosis.